There are a few common terms or features of bone that we talk about here. First is the process. It's a natural outgrowth, projection, or appendage to bone. A condyle is a small, rounded articular process. A facet is a small, flat articular surface. A fossa is a shallow depression. A sulcus is a narrow passageway. A foramen is a round passageway, or foramina, plural. A canal, or meatus, is a passageway through bone. Fissure is an elongated cleft, so a large groove, and a sinus is a chamber within bone. This model shows the disarticulated bones of the skull. So if we take this and drop it back, we can see the maxillary bones, we can see the ethmoid, the nasal bones, the lacrimal bones in green, the inferior nasal conchae, the palatine bones, the zygomatic bones, the frontal bones, the parietal bones, the occipital bone in the back, the temporal bone on the side. Underneath, we have the sphenoid bone, and then this is the mandible. This is a model of the skull. We have the coronal suture, the sagittal suture, the lambdoid suture, and the squamous or squamous suture. And then I'm going to remove the mandible and the top of the head so it's easier to see. First, we have the lacrimal fossa, or the fossa of the lacrimal gland, the supraorbital margin, the infraorbital margin, and the supraorbital notch or foramen. Those are these right there. And then we have the parietal bones in general. Those are these bones right here, these two. Then we have the occipital bone. First we have on the back external occipital protuberance leading to the external occipital crest. On the inside, the internal occipital protuberance to the internal occipital crest. Then we have occipital condyles coming from the bottom. Those are these. Through the occipital condyles, we have hypoglossal canals. And then down here, we have jugular foramina surrounded by the jugular fossa. And then this large hole in the middle is the foramen magnum. There are sinuses in these models, and in addition to that, there are the superior nasal conchae. Those will be covered on a different model. Here in the temporal bone, we have the zygomatic arch. This is a fusion of two processes, the zygomatic process of temporal bone and the temporal process of the zygomatic bone. These being the zygomatic bones, these being the temporal bones. The temporal fossa, it's this indentation on the side of the head, this whole indentation. And then we have the mandibular fossa. That's this groove or indentation here where the mandible sits, the condylar process of the mandible will sit. Then we have the mastoid process and the styloid process in between the stylomastoid foramen. Coming on the inside, we have the squamous part of the temporal bone. That's this flat section. And the petrous part of the temporal bone. That's this ridged section. And then we have here on the petrous part the internal acoustic meatus, or internal auditory meatus or canal. And then coming from the other side, right here, we have the external acoustic meatus or canal. And then if we look at the most medial foramen, we'll see that this is the foramen lacerum. We can see it from the inferior side, foramen lacerum. And finally on the occipital, or on the temporal bone, we have the carotid canal, and this comes through here on the petrous part. Next, if we look on the inside, we have the cribriform plate. That's this horizontal section of this ethmoid bone, and then this vertical projection is the crista galli. In the cribriform plate, we have small holes where the olfactory nerve goes through. We call those the olfactory foramina. And then we have the perpendicular plate. If we come over here, we look here, this is the top portion of this middle septum in the nose, is this perpendicular plate. And we can also see from the front, we have inferior nasal conchae and then middle nasal conchae there. We can't see the superior nasal conchae on this model. We can also see a couple of the sphenoid structures here. We have the pterygoid processes right here. And if we look in here, this is the hypophyseal fossa, and the body of the sphenoid here is this whole thing. Right here, this is easier to see on the disarticulated sphenoid model. And the structure surrounding the hypophyseal fossa is the sella turcica. The sella turcica is that structure, and the hypophyseal fossa is that indentation. And we can also see the lesser wings here and here, and these would be the greater wings, again, easier to see on the disarticulated model. And then if we look, we can see three holes. We have the foramen rotundum, the foramen ovale, and the foramen spinosum. These can also be seen from the underside a little bit more difficultly. We have, right, we put our pointer through, we can see them. Right, so we have the foramen ovale and the foramen spinosum from this side. If we look right here on the petrous part, we can see portion or where the carotid canal comes through the skull. And then we have the optic canal right there, the superior orbital fissure and the inferior orbital fissure. Looking at the front of the face, the front of the skull, we have the orbital rim. This is the area that goes around the eye or the orbit. We have the anterior nasal spine. That's this bump on the front there. We have these bumps that are going around the teeth. These are the alveolar processes. Then we have the nasolacrimal canal, which is this canal that goes right here by the lacrimal bone. And then we have palatine processes, which are these extensions of the palatine bones. And then we have below the eye, the infraorbital foramina, right here, these guys. One of them is an infraorbital foramen, both are the infraorbital foramina. And then if we take the mandible that we set aside earlier, we have the body of the mandible, that's this whole section right here. And then we have the mental protuberance, is this bump right there. And then we have the mental foramina, which are these holes right here. And then we have the ramus of the mandible, that's this section that kind of comes up. Right here's the angle of the mandible. And then we have the condylar process of the mandible, that's this one, more posterior, and the coronoid process of the mandible is this one, more anterior. And then if we flip it around, we have in the back the mandibular foramen, or mandibula foramina plural. And if we come back here, we have the zygomatic bone. Zygomatic bones are these two right here. And we have the palatine bones, just mentioned, are these guys. And then the nasal bones are these right here on the nose. And we have the vomer, this is this lower portion, right, below the perpendicular plate. Then we have the lacrimal bones, mentioned previously, are these bones right here. And then we have the lacrimal sulcus right here, or the lacrimal groove. A better name would be the fossa for the lacrimal sac, whereas the fossa for the lacrimal gland was up here. The fossa for the lacrimal sac is down here. One last hole in the bottom of the skull. We have the condylar foramen, which are these holes right here, just below the condyles, surrounded by the condylar fossae, or fossa singular. This model is a sagittal cross-section of the skull, and here we can see our sinuses. So first we have the maxillary sinus right in here, medial to the zygomatic bone, And lateral to the nasal conchae, up here we have the superior nasal conchae, the middle nasal conchae, and the inferior nasal conchae, again the maxillary sinus. And over here we have the sphenoidal sinus, and this is surrounded by bone marrow. That's what's being shown by this red here of the spongy bone. And then we have in the front, the frontal sinus. This is this opening or space. It's not really an opening, it's a space in the skull. And if we turn it around, we can see this right here in the mastoid process, the mastoid sinus. This is a disarticulated sphenoid bone, and on this sphenoid bone we have the body of the sphenoid, this region right here, and in that region we have a structure called the sella turcica. In the sella turcica we have a depression called the hypophyseal fossa. And then here we have the lesser wings, the greater wings of the sphenoid. And we have pterygoid processes, these projections. And then we have the optic canal, this hole right here. You can look at it from the front, be this. And then we have three holes. We have the foramen rotundum, the foramen ovale, and the foramen spinosum. You can see them over here, rotundum, ovale, spinosum. And then we also have the superior orbital fissure, which is this groove right here. That is all for the sphenoid. Here we have a hyoid bone. We have the body of the hyoid. And then we have the lesser horns of the hyoid and the greater horns of the hyoid. This is not to be confused with the baby mandible. This is this bone. You can tell the difference because it has these processes very close together, the coronoid process and the condylar process, like talked about on the adult-sized mandible. This is a baby head, and on the baby head we have four terms. We have the frontal or anterior fontanelle, then we have the sphenoidal fontanelle, mastoid fontanelle, and the posterior or occipital fontanelle or lambdoid fontanelle. We're going to be taking a look at the vertebrae. First we have C1 and C2, the atlas and the axis, connected by the dens of axis. And then in general, we have cervical vertebrae that look like this. We think they look like foxes. Here we have thoracic vertebrae. We think they look like giraffes. Here we have a lumbar vertebrae. We think they look like moose. There are 7 of these, 12 of these, and 5 of these. In general, we'll be using this one to do demonstrations on structures. So we have the vertebral body. We have the vertebral foramen. And if we stack vertebrae on top of each other, it becomes a vertebral canal. Then we have the vertebral arch. That's this. It's this whole projection from the body. And then we have pedicles, which are these projections directly from the body. We have laminae, one lamina, multiple laminae on the top. They come together and they produce the spinous process of the vertebrae. And then we have here transverse processes on either side. And we notice what's special about these guys, the cervical vertebrae, is they have holes in their transverse processes. We call those transverse foramen. And then if we look here again, we have superior articular processes, inferior articular processes, superior articular facets. Those are the smooth sections. The processes are the bumps, and the inferior articular facets. And then between the vertebrae, we'll have intervertebral discs. You can see those here on this model. They're these guys. And again, these stacked on top of each other produce the vertebral canal. And then if we have vertebrae stacked on top of each other, where the nerve's coming out, that's going to be called the intervertebral foramen. That's where we have multiple vertebrae coming together to form a whole. Specific to the thoracic vertebrae, we have costal facets. Those go here. Transverse costal facets go here. And then we have regular costal facets. Those go here. And then I have this one back here. This is also a thoracic vertebrae. This is T12, even though it looks like a lumbar vertebrae. We can tell because of the articular or the costal facets that are found here on the body. Here we have a sacral bone or a sacrum, and this is the fusion of 5 vertebrae. And we can have the sacral canal, that's this hole going through the sacrum, the median sacral crest, this ridge on the top. We have the sacral hiatus, this opening at the bottom of the sacrum. We have the sacral promontory, which if we look here on the anterior side is this ridge. Then we have sacral foramina, which are these holes in the sacrum. And then we have the auricular surface of the sacrum, which will be this. This will articulate with the coxal bone, right? And that's on the side. It's on the lateral portion. Then we have the apex of the sacrum, which is this region down here. This is where the coccyx would join. And then up here we have the base of the sacrum. This is this whole top section. Up top is the base of the sacrum. Here we have a model of the vertebral column with the sacrum. And then here we have the coxal bones attached. So this is the coccyx or the coccygeal region, and it's made of 3 to 5, usually 4, fused vertebrae. This is a rib, usually referred to as a costal. And up here we have the head of the rib, the neck of the rib, the tubercle of the rib, the body of the rib. The costal groove, this is on the inferior side. And we can determine right or left by positioning the head of the rib posterior and the costal groove inferior. So this is a left rib. This model shows a section of the breastplate. We have the sternum right here. This is the body of the sternum. This is the manubrium up top, and the xiphoid process, this projection at the bottom. And this orange tan stuff coming off of the side is the costal cartilage.